Good day all, I'm Dr. Dev. I'm a consultant psychiatrist in Delhi. So today we are going to talk about depression. So what is depression? To answer this question, I will take help of this book. What does it say? In depression, there is depressed mood which is pervasive throughout the day. There is loss of interest that we also call anhedonia, meaning the person is not able to enjoy the things which he used to enjoy earlier. So previously pleasurable things are not pleasurable now. There is reduced energy, easy fatigability. By doing a slight activity, even after doing a slight activity, the person feels so much tired. Along with that, there are other symptoms also like decrease in attention and concentration, reduced self-esteem, reduced self-confidence, ideas of guilt, pessimistic views about future, disturbed sleep and disturbed appetite. So how the depression is different from sadness? So the sadness is an human emotion. Anyone can be sad anytime, but that is temporary. That is not there as like depression. So I forgot to mention one thing, that in depression we take a time duration also. Those symptoms should be present for minimum of 2 weeks to call it a clinical depression. And also sadness fades with the time, but depression might not. It might increase initially and will stay up to a defined period of time. So now the question, can depression affect anyone? So there is 3 to 5% of prevalence and it can affect anyone. What are the risk factors for depression? You will see that there can be the financial difficulties, there can be the lower socio-economic status, stressful life events that trigger so many depressive episodes, the lack of social support, serious or chronic illnesses like obesity, diabetes, epilepsy, hypertension, cancers. Also, vitamin D deficiency and vitamin B12 deficiencies are also the risk factor for depression. So does every person with depression need treatment? Yes. If it is according to this book, if it is falling into the criteria, the person needs the treatment. If it is sadness, it will go away, but we need to find out that it is depression, and clinical depression needs treatment. So what are the treatment options available? So we have psychotherapy. Some people also call it counseling or talk therapy, but I would like to tell you that these are not just talking. It is a set of clinical things. It is a set of clinical methods which are derived from the psychological techniques. So it is not just a talk therapy. Next is pharmacotherapy, what we call giving the medicines, as like selective serotonin reuptake inhibitors, SSRI or SNRI, which we give to enhance the level of serotonin in the brain so that mood can come back to the normal level again. Other new therapies are also there, which is RTMS and TDCS. RTMS means repetitive transcranial magnetic stimulation. With a machine, we give magnetic stimulation to specific area of brain. And also TDCS, transcranial direct current stimulation. In this, we use our DC current machine. Not at all dangerous. Also, there are new evidences which are coming up these days with the newer studies that yoga, pranayama and meditation is also effective, mainly in the mild to moderate depression, but these are effective. So what can you do if you think you are depressed? So visit a psychiatrist or a psychologist or any mental health professional. And if you're not able to find anyone out of that, you can visit your family physician. How can you help someone in depression? Support them. Never criticize, never blame them, always support them. Empathize with them. There is no need to show sympathy or pity, but stay with them. Hold them. Listen to them. Find out what difficulties are they facing. Is there any reason? Is there any stress factor for that? Inform other people also. Take other people into the loop, because if any bad thing happened, You might not be alone to handle that thing. So inform the friends, inform to the family, inform to the spouse, always inform. And refer to a mental health professional. It is nearby, it's okay, or otherwise fine, and refer. So we talked about depression. Thank you.